Good afternoon, everyone. Thank you for joining us today. A quick time check. It's 3 p.m. in Singapore on the 6th of September, 2021. It's with great pleasure that I welcome all of you to the SDGHI Perspectives webinar titled COVID-19 Immediate Vaccine Needs and Considerations Beyond, organized by the SingHealth Duke-NUS Global Health Institute. I'm Shreya and I'm a research associate at SDGHI. Today, we're gathered for the closing webinar of the inaugural SDGHI Perspectives Essay Series on COVID-19 vaccines in Southeast Asia, which was launched earlier this year. In the panel this afternoon, we have selected authors who contributed to the first essay series, and I'll be posting the link to the series soon after this introduction. A few quick housekeeping rules to note before we move ahead. As you know, this webinar is being recorded. Please do keep yourselves on mute at all times and feel free to send in your questions using the Q&A tab below. The questions will be addressed at the end of the session after the moderated panel discussion. Before we find out more about the speakers today, I'd like to introduce Ms. Amina Mahmood, who will be moderating today's webinar. Amina Mahmood Islam is a Deputy Director at SDGHI, and she has expertise in implementation of national level health programs, global health strategies, and multi-country collaborations. Her research interests are in health system strengthening through development of primary care capabilities. Her current responsibilities lie in bringing together the multiple parties involved in research, education, policy development, and capacity building across the SingHealth Duke-NUS Academic Medical Center and regional collaborators in a way that builds synergies. Previously, she was Deputy Director of the Signature Program in Health Services and Systems Research at Duke-NUS. Prior to working with Duke-NUS, Amina was the Deputy Representative for the United Nations Population Fund country offices in Ethiopia and Bangladesh. Thank you, Amina, for moderating this session today, and over to you now.
Thanks, Shreya. Thanks a lot. And I extend a warm welcome to the audience and a big thank you to our three panelists who I'll introduce in a minute. But as Shreya mentioned, this webinar is a follow-up to our essay series in which we engage different stakeholders across the region to kind of elicit their topics of interest in the evolving story of COVID-19 vaccines. We were pleased that we had both experts like the ones we have with us today, as well as students and national representatives who contributed to the series. And we really hope to have kind of added dimensions to that ongoing discussion. And of course, the story of COVID-19 vaccines is far from over. We're still very much, grappling with the many dimensions it has. Countries across the world are still having to deal with the virus, as well as all these control and containment measures of which vaccines are the central element. So today we want to try and see what the story looks like in Southeast Asia, how the countries there are doing. We want to consider if we can bridge the gap between science and policies in this race to vaccinate against COVID-19, because there really is some room to discuss what those issues and why that gap is there. We also want to look at issues of vaccine equity from regulatory and ethical perspectives. We'll review what happened and also maybe more importantly discuss what will and what should happen. We'll be looking at it both from the public health and policy perspective, as well as the kind of ripple effects across economies and communities. Our panelists today are all experts in their respective domains, and we really look forward to a lively exchange. It's going to be more of a conversational mode, so not long presentations. They'll be making very short opening statements, and I will be asking them some questions, and we really welcome and hope to have questions from the audience. We hope to have this a very interactive discussion, so I'm looking forward to that. And with that, I'll start the introduction to our first speaker. And our first speaker is Dr. Swee Khor. He's an independent public health policy specialist. He's a Malaysian physician who specializes in health policies and systems with fellowships in Chatham House, United Nations University, and Institute for Strategic and International Studies in Malaysia. He has international expertise in the public, private, nonprofit, and think tank centers. He has held senior roles in 4 practice areas, which include clinical medicine, refugee and disaster relief, clinical research, and healthcare anti-corruption. In these roles, he was based in Malaysia, in Singapore, UAE, China, and France. He was covering more than 90 countries across these regions. And in terms of his degrees, he's had postgraduate degrees in internal medicine from the Royal College of Physicians, public health degrees from Berkeley, and public policy degree from Oxford. So you can see a man of really deep policy experience and expertise. We're delighted to have him with us today. And speaking over to you for your opening remarks.
Amina and everyone in SDGHI, thank you very much for having me here. I hope you can hear me well. I will not be sharing any slides today, but I thought to spend maybe 2 or 3 minutes as opening remarks to talk about 3 areas. The first area is that Amina is very right. The science of it has worked out for us that we've got a selection of, I think about 10 or 11 approved vaccines around the world. But right now, the science has to be translated to policy. So the scientists have handed off to policymakers, decision makers, political leaders, technocrats, bureaucrats, logisticians, doctors, nurses, people who will bring the vaccines to the, 650 million people across Southeast Asia. And that's not science. That requires politics, economics, public administration, and public policy to sort of take over for where the scientists have left off. And this is a large undertaking, perhaps the single biggest and single most important vaccination program in the history of Southeast Asia. So I guess that's my first observation, that scientists are handing off to other professionals, such as you listening in today, and it's our responsibility now to vaccinate and to deliver a strong and, shall we say, effective vaccination program. That's the first observation. My second observation in the opening remarks is to talk about the short-term challenges in Southeast Asia's vaccination program today. We know that vaccination works, and hopefully now that Southeast Asia is really the epicenter of COVID cases around the world, looking at Malaysia, Indonesia, and the Philippines, we hope that the vaccination programs can be fast and hopefully very furious so that we can reduce the temperature and the community viral load for COVID throughout Southeast Asia. But that requires for us to consider a few challenges. Number one, the administration programs of this vaccination need to continue on, and we need a strong private sector presence as well as civil societies in place. Secondly, we will at some point, national strategies will have to at some point consider the need for booster doses. Thirdly, and perennially, we have to consider things of vaccine supplies as well as vaccine confidence. These things are interlinked. If you can, for example, vaccinate very fast and therefore indicate or rather prove a causal relationship that cases have dropped, vaccine confidence will increase. But if you don't have supplies, no matter how good your vaccination programs are, you will not be able to achieve the objectives of the vaccination programs that you seek out to start with. So the point I'm making is the short-term challenges can be seen in isolation, but they're truly very interlinked. Thirdly, and finally, Amina, if I may, there are some long-term implications for our vaccination programs across Southeast Asia as well. I've given a bit of a landscape. Hopefully, we can go down deeper during the Q&A section. But I'm thinking of things like the vaccine economy, meaning at some point, it cannot only be Thailand or Malaysia or Singapore that's manufacturing vaccines for Southeast Asia or for their domestic users. It probably has to be decentralized. And that's just on the vaccine economy side, as in the production and the manufacturing of vaccines, but then on the entirety of the vaccine value chain, all the way from production, frankly, even before that, the supply chain for the production, all the way to the implementation and the administration of it will be challenges for Southeast Asian countries in years to come. Amina, let me end my comments over here and pass the floor back to you. I look forward to the Q&A. Thank you.
Thanks. Yes, there's lots more to kind of delve into those topics, but let's hear from our second speaker now, who is Professor John Lim. John Lim is the founding executive director of the Center of Regulatory Excellence and the policy lead for our institution, SDGHI. He's also a professor of practice at Duke-NUS and the NUS Swee Khor School of Public Health. He is the inaugural chairman of the Consortium for Clinical Research and Innovation in Singapore and senior advisor at Singapore's Ministry of Health. Formerly, he was chief executive officer of Singapore's Health Sciences Authority and deputy director of medical services in Ministry of Health. He's had many senior positions in Singapore's health and education ministries, and his current role really promotes capacity building and scientific excellence for health products regulation and health policies in Southeast Asia and in Asia Pacific. So with that, I'm delighted to have him here as our spearheading our policy work, and over to you, John.
Well, thank you very much, Amina, and it's a pleasure to be on this panel with Susann and Swee Kheng. Let me just share my screen. I have a few slides to just run through as opening remarks. So I'm showing this slide because it's a need. We need to be reminded of the role of regulation. When I was in the Health Sciences Authority, my chairman, tongue-in-cheek, said people used to see regulation as exciting as grass growing. But obviously, in the context of COVID-19, I don't think anyone sees regulation in that context anymore, and especially when we're talking of COVID-19 vaccines. And this slide really highlights that regulation is a socio-economic enabler, very much linked to the Sustainable Development Goal 3, and it needs to be done well, as we are very much conscious of in the context of the pandemic and vaccines. But what is also important is that in the course of this pandemic, this whole notion of regulatory agility has really come to the fore. We began to see it really picking up in 2020, although the seeds for this on the platforms have been laid, quite honestly, internationally in the preceding decade. But really what we're talking about here is regulatory agility to facilitate timely patient access to health products. And those three aspects are important: a risk-based approach, regulatory cooperation and reliance, and regulatory convergence. And we've seen this happening to facilitate quick approvals of vaccines as they've come round from the end of 2020. What we've also seen, especially in the course of last year and into this year, is that the pandemic has advanced regulatory coordination and information exchange. And this has been quite critical, especially for regulators in low and middle income countries, to be able to make faster decisions when it came to vaccines. And so there's increasing use of reliance, referencing, and convergence. And these are concepts which the WHO promotes very strongly to facilitate faster emergency use authorization decisions. And so speedy vaccine approval has been facilitated by those points you see there: parallel development processes, rolling data reviews, and that's very important at this point in time, the greater use of real-world evidence and monitoring, and of course, emergency use authorizations and conditional approvals. This is just an illustration again to highlight what convergence means. It means that regulatory requirements become more aligned over time with the adoption of internationally recognized technical guidance documents, but it doesn't mean that everything becomes absolutely the same, which is what harmonization, which is that kind of aspirational goal, which has been talked about for a long time, but convergence is really what people are thinking about nowadays. But we have seen this challenged in recent months, because as Swee Kheng was mentioning earlier, a lot of political and socio-economic challenges have come in, impacting regulation, scientific evidence-based decision-making, and vaccines equity. And of course, what we've seen is different vaccines with differing efficacy profiles used by countries. And even if we look across Southeast Asia, we see this. The type of vaccines being used across the 10 member states of ASEAN are a differing bunch of vaccines. And what we've also seen is urgent socio-political considerations taking precedence over regional regulatory cooperation. And of course, this has been influenced by this rush to pre-purchase vaccines, so they arrive ahead of regulatory approval due to the need to fulfill contractual requirements. And this is adding pressure on national regulators. National regulators generally look at safety, quality, and efficacy in a timely manner, and they should be independent of political considerations. But as Swee Kheng was saying earlier, this is actually not what we're seeing at this point in time. And it's being further challenged by the fourth bullet point, the impact of the new variants, especially the Delta variant. And now, because of differing policies on booster doses, even within ASEAN itself, the difference between high income and low and middle income countries. And this is my last slide. So we see regulatory convergence being immediately challenged due to those points, but also there's been a lack of well-established, well-accepted regional regulatory referencing frameworks. If these had been in place and had been more strongly entrenched, we probably would have seen a data-based, evidence-based approach. But nonetheless, I'm optimistic that as we go through the pandemic and beyond, convergence will still be there because countries need to make quick decisions, and lower resourced regulators without that kind of expertise will need to continue to depend on decisions of well-resourced regulators with higher degrees of expertise. But it's the last bullet point that I see changing quite significantly, because if you look across not just this region, but the world, you will see in different countries, regulators have a different voice. Now, in Singapore, we're very fortunate because the Health Sciences Authority basically sits at the table with all the policymakers and the Ministry of Health, the expert committee on vaccines approval. And so that input is very much part and parcel of decision-making for the policies that the Singapore government makes. It is not necessarily the case in many other countries where we often say the regulators are like the Cinderellas of the health system, where they're put in one corner or extremely siloed in their thinking. And I think because of the experience of the pandemic and dealing with COVID-19 vaccines, decisions on booster doses, things must and will have to change to deal with future health challenges. So those are my opening points, Amina. Back to you.
Thank you. Yes, you point to the complexities of it, but you end on a positive note, so that's good to see. At least you're optimistic that we will get to convergence, as we kind of, in a practical sense, has to. I now introduce our third panelist, who is Dr. Susann Roth. She's the advisor and chief of Knowledge Advisory Services Center at Asian Development Bank. Before this role, she launched ADB's Operational Plan for Health 2015 to 2020, which brought back the health sector to the ADB. She piloted innovative health sector interventions for regional health security and pandemic preparedness at the ADB. She holds a medical doctorate degree and a PhD from the University of Heidelberg in Germany and a Master of Public Health and Policy from the University of the Philippines. She has been trained in general surgery, emergency medicine, and tropical diseases in Germany, the US, and the Philippines. She also serves as adjunct professor at LKY School of Public Policy in Singapore from 2016 to 2018. And she has been a member of the World Health Organization External Technical Advisory Group for Innovation in Digital Health since 2019. And so with all these different hats, we'll really look forward to her insights from these vantage points. And over to you, Susann, for your opening remarks. Thank you.
Yeah, thank you. Thank you very much, Amina. I'll bring different perspectives here. I mean, first, I want to continue on what John spoke about with the convergence of regulatory practices. And I think what was really interesting is that when John and I, when we started to work together in 2015 and 16, we looked at regulatory science and the need for regulatory changes already from the perspective of pandemics. So I think we were quite ahead of time looking at certain aspects of it and on the need of regulatory convergence, especially for regional health security. I think what we didn't anticipate at that time, at least not me, maybe you, John, was the socio-political context and the political economy around pandemics and regulation. And maybe that's something we need to pick up on later on. But let's talk a bit about the confluence of risks that we have seen with the pandemics. I mean, obviously, it's not the virus alone that led to this pandemic. And I think what we need to recognize here, and this is important for health interventions, but also for regulation, is the pandemic is really driven by the lifestyles we lead and by the population health status that we see. So we see an increase of obesity, diabetes, hypertension, especially even now under lockdowns. Great risks are imposed to children, many who have been locked up, for example, in the Philippines for more than 19 months now. Can you imagine being in your house, not being allowed to go on the street, schools being closed? So these are, I think, important aspects we need to consider as we speak about vaccines. What we see also is a lot of discussion, a lot of money is going into vaccines, into the quick development, but also quick distribution. But at the same time, health workers are actually not getting more money. They're not even being paid in some countries. And we see crowded health facilities. So it seems that while we do have some level of mechanical solution, we are not addressing some of the root causes that are actually driving the pandemic. And I'm provocative here. One reason might be that the people who make decisions currently are not very diverse. We see in global health, but also national decision-making, lots of men and similar thinking men. So it's something we also need to bring up. And it's definitely an issue, I think, also when we look at the socio-political dimensions of regulation. At the same time, a big threat and something we really need to discuss is how health sectors and their budgets are currently being, what do I say? Yeah, I mean, the tension is all on vaccines, but we see decreasing in funding for other health issues and health agendas. We see a decrease of funding of child health, decrease in vaccination coverage, decrease of maternal health services, Prenatal care has dropped to about 1/3 in the region. So I think these are very important aspects we need to consider. While we see a speed of research and maybe new regulation for biosimilars, especially in developed countries, I'm not sure we are seeing it in Southeast Asia. In our developing countries, John and the Center of Regulatory Excellence has worked a lot on capacity building for regulation of biosimilars, but we do see a threat here right now that the vaccines are taking over the attention and also the attention for deep institutional capacity development. So there's definitely a threat here. And what it leads to is potentially a bigger and faster increase in inequities. Inequities in terms of access to high-tech medicine, which would be then only for a few, a lot of more inequities for an access to personalized medicine, the kind of medicine we are seeing now with biosimilars, especially with cancer care, and maybe a commoditization of vaccines. You see already in the US, obviously, vaccines are being offered in health in malls and pharmacies and so on. Maybe we see that now more also with other kinds of medicine, and there is a question of safety, post-market surveillance, and so on. And maybe we see more of this kind of factory-like healthcare, quality care for many, but then can we really cater to the more specialized diseases and so on? So I think a lot of things we need to consider. I want to mention here what we do see right now, that there isn't a lot of healthy future for many people. With all the attention on the pandemic and the attention on vaccines, many people do not get access to healthcare, and we do see a lot of collateral deaths from many other diseases, and for people who don't have access to the basic medicine and technology. So I'll stop here.
Great, thanks, Susan. You bring up so many important points, the need to look at it from the systems level, the need to focus on vaccine equity and just equity, health equity, not just vaccine equity, and really, how are we going to try to address these gaps without, by taking a maybe radical rethink of how decisions are made. But we already got some questions in from the audience, so I do want to kind of address those. And one of the first questions we got, and I think it's come across in all your opening remarks, is about boosters. So maybe Swee Kheng, I will ask you this question and direct it to you. What's happening with boosters? Do we need them? What's the equity issues on them? What are going to be the way they're distributed? How can the different countries make the decisions? Maybe John can answer that on the regulatory aspect, on how are we going to regulate this? What kind of planning and preparation is required? So Swee Kheng, maybe first to you and then to you, John.
Amina, this is a very large set of topics to sort of unpack, right? So maybe I'll make 3 comments, brief ones, and then pass the floor over to Professor Lim, and it'd be great to hear what John has to say. First is science, secondly, equity, thirdly, policy. Science, equity, policy in that order. The science of it may indicate to us that different people have different immune responses after they get a COVID vaccine. And different vaccines will also elicit different levels of responses as well. And these responses, whether they be humoral, as in antibodies, or they could be T-cell related, this will usually wane over time. Now, science is still discovering what it means for the latent immune system in terms of memory B cells and also T-cell function, to see whether or not we actually have much longer immune protection from COVID, more than just IgG, IgM, or neutralizing antibodies. So the science of it may indicate that for most people, the immune system will slowly drop over time. This may be similar to the flu vaccine, but more data is being discovered to show exactly what sorts of what portions of the immune system will sort of go away and what portions of the immune system will stay. That's on the science of it, but broadly arriving at a consensus that generally speaking, some people may need boosters. Number 2, it's about equity. If we provide a booster for people right now, we may be taking a scarce and limited vaccine dose and not giving it to another person who has never received a vaccine. And that equity argument is very clear, and the World Health Organization has come down against boosters and in favor of vaccinating everybody in the first instance. We can appreciate that. However, one can also say that if a person has received 2 doses of the vaccine and doesn't have any adequate immune response, it is not the person's fault. And if it's a 65-year-old person with 3 comorbidities and it's on kidney dialysis, for example, receives 2 doses of any vaccine, doesn't matter to me, and doesn't have a response, one can argue that that person still remains a high-risk individual and therefore needs a 3rd dose. And if you think about it in a slightly different way, we use the term booster, but it could just be a 3rd dose in a regular schedule. What I mean to say is vaccines like diphtheria, pertussis, tetanus, polio, hepatitis B, hepatitis A all require a 3-dose regimen. So that's some unpacking from an equity perspective. Thirdly and finally, Amina, I think we're having a false binary choice. We think that it's blanket boosters, meaning boost everyone, or no boosters at all. Maybe we don't have to go on either end of the extreme, but there could be something a little bit more nuanced. Let me call it a targeted booster campaign. If there is a way for us to determine whose immune systems might need boosting, then we can boost them, as opposed to boosting everyone, which I think would be unfair, wasting also the risk of hyperimmune reactions for people with very strong and sustainable or durable immune responses, and not boosting anyone, which could be a little unfair as well as unsafe for the people who might need a little bit more protection. I mean, those are my comments from a science, equity, as well as a policy perspective. Over again to you.
Thank you. To John, actually. John, did you want to add anything?
Well, I think Swee Kheng has summarized it very nicely. What I would like to point out is that when we talk of boosters in the normal sense for other vaccines, you were talking about vaccines that have been approved and that have been used for some time. We need to realize that none of the COVID-19 vaccines really have achieved full marketing authorization apart from the Pfizer-BioNTech mRNA, and that's only in the US so far, because the FDA just about a week and a half ago approved that. So in fact, all our vaccines are being used under emergency use authorization, and they have also had different efficacy profiles even at the initial point of assessment. So that's a first starting point, remember. And so when we're making these decisions on boosters, it's actually still not quite fully in the domain of the drug regulators at this point in time. These are decisions being taken by expert scientific committees looking at broader socio-political issues as well. And of course, as Swee Kheng said, there is, of course, a sort of basis for this. I mean, clearly, if there is concern about waning antibodies, then especially for those who are immunocompromised, for those who are elderly, there is probably a case. The question is from an equity, fairness point of view, and I think Dr. Tedros very clearly came out and said, really, no country should be considering booster doses until at least the end of September. And I think that's largely because it's a question of manufacture and the ability to get existing vaccines, even under the WHO emergency use listing, out to as many countries as possible. And this is facing major logistic issues. So it's a very complex issue, which of course, as Swee Kheng said, you start with the science of it to see when boosters are appropriate to consider. But then the question of equity and ethics comes in, and it's not very clear either. So in another talk I was giving the other week, I was saying I was listening to this, interview of an anesthetist in the US, and he was saying he was offered the 3rd dose. And healthcare professionals, of course, I presume he was on the elderly side, they're more exposed to this. And if there's a concern about waning immunity, he said he took the 3rd dose because the other consideration was that the supplies were about to expire. So it's not a simple question of just rechanneling your supplies to another country if they're on the point of expiry. So I only say this, Amina, to highlight that the whole decision on boosters and whether or not to apply them is not a very straightforward issue. And I think really, in fact, I was reading an article today, and I think it picks up Swee Kheng's last point. It's not a simple dichotomy. You actually need to do both. You need to increase the supply of vaccines, whatever is available, to all countries around the world. You need to boost manufacturing capacity as well. And then for those who really need the booster doses, make those available. Otherwise, whatever gains have been achieved, even by the developed countries, will potentially be compromised going forward. So I just throw all this in to highlight that it's a complicated question, and really decision makers at national level have to consider all this when making that decision. Over to you, Amina.
Yes, and they're making these decisions, as you point out, when the science of it is still not fully worked out. So yes, we have the vaccines in their first stages, but we don't have the data on what the impact is over the longer term. There was a question from the audience also about what is the long-term side effects. Will we need to keep taking boosters? I won't even ask the panelists this question because I think the answer is simply we don't know. So a lot of the scientific questions still remain, and even as those remain, it's the translation into policy that it remains also very thorny. And to that aspect, maybe I'll turn to Susann. How do we kind of make this gap? How do we bridge this gap? So we have science, which is, certain aspects of it have been worked out, not all. And then we have these policies, which are, very much taken in the national context. How do we bridge that to make it a more effective and a more equitable policy rather than just and also maybe more regionally oriented rather than just nationally oriented?
Yeah, I mean, these are fantastic questions. I invite everyone, by the way, to join the Asian Development Bank's Knowledge Forum, because we will discuss these aspects. How do we create a better pathway from evidence and science to policy? And thinking about it, I think what we realize, and there's some good work coming out from the UCL Institute for Innovation and Public Purpose, we need to build different government capabilities, and we need to create more independent bodies of which manage knowledge and which take decisions. And obviously you need to have diverse stakeholders in there, beneficiaries, obviously scientists, but also people who can apply moral frameworks. And I think that is what was missing in the last 2 years dealing with COVID. I mean, lots of people wondered, where is that moral framework? If you also think about the overall policies that we're taking on lockdowns or school closures, or even, if you think about distribution of vaccines, it seems there is obviously a human behavior of short-termism. And we think, we find a solution, we go after it, and it ends soon. I think that was obviously the hope with vaccines. But we need to start to think a bit more in systems, and create these bodies in government which look at that problem from various angles. As John said, I mean, it's while we have to think about regions, we have to think about the national situation. You don't want producers to go to waste. You need to have also the systems in place to deliver the vaccines. And maybe you can think also how, while you deliver the vaccines, you improve overall healthcare, health promotion, and preventions. I mean, there's huge opportunity right now when you administer the vaccines to also check for other risk factors. And this brings me maybe to my last point, and that is really a better risk-based approach to regulation, but also to administering the vaccines and any kind of new medical products. So boosters for all, the answer is no. Booster for, targeted population groups, probably. The same discussion can probably be held about, should we vaccinate everybody? I mean, I think even that is still a discussion to be held and controversial as the data comes in.
Thank you. Yeah. And you bring up this very important point of the different stakeholders involved. We need to do this collectively. I think everyone, you in your opening remarks, you also talked about who's making the decisions. So Swee, maybe I'll turn back to you as a public health specialist. What is the role of populations, of the media, of civil society organizations in ensuring that governments and politicians are accountable? What can we do, we as a diverse group of stakeholders?
This is a great question, Amina. A question probably a little bit more related to politics, political science, and the art of nation building and democracy. So maybe I'll answer in two ways. The first one is to say that the media plays a very important role, holding the government accountable. We're now seeing, shall we say, COVID being used by many authoritarian governments as a way to extend their security argument to erode democracy. Parliaments are closed. The scrutiny of parliamentary scrutiny or media scrutiny or public scrutiny of government spending will be reduced. All sorts of laws or new laws are coming up. And if you just Google erosion of democracy due to COVID, there will be a number of think tanks and research units who will give us quite a lot of information about how the pandemic was securitized and in many cases militarized, for example, against foreign workers and migrants and refugees, in order to achieve some sort of fig leaf of, shall we say, protection for its citizens. So anyway, all that is to say that the media has a very strong and important role, especially as a bulwark against any erosion of democracy. Let me set that aside and focus a little bit more on the role of the media for vaccination programs. Maybe there are two very clear roles. Number one, the conveying of information, and number two, the managing of expectations. Conveying information can be done in a way that is very thoughtful, classy, appropriate, factual, accurate, also, more importantly, responsible, meaning no sensational information. For example, we will see breakthrough infections after vaccinations, and vaccinations will have something called AEFI, or acute adverse events after following immunizations. These have to be reported, but in a way that is non-sensational, non-panicky, and doesn't portray a wrong picture for the safety and the overwhelming benefits of vaccination programs and vaccines themselves. So I think that's an important role for the media to be very, shall we say, responsible in their reporting. And one final point, Amina, if I may, is that the media will probably have to train governments how to communicate, and governments will have to provide a lot of information to the media for them to communicate. An example can be brought in from Belgium, where I've heard that, and I've also, it's also been reported, so not just I hear, but also it's been reported, that the media in Belgium have actually been having very close meetings and a very systematic approach with the Ministry of Health in Belgium. They are training the technocrats and the health professionals in the ministry how to communicate to the public, and the ministry is teaching them science communication. So I think this is one very good best practice that we can use for journalistic practices and media, the relationship between media and ministries of health across Southeast Asia. Thanks, Amina, over to you.
Thanks, that's an interesting story, and I'm sure many countries can learn from that. But extending the same kind of discussion point to regulators, John, what is the role that regulators can play in maybe also ensuring that governments are accountable? You know, what's that back and forth? So the regulators are part of the machinery, but maybe have a very specialized role in it. So how do they interact with the larger governmental, policy bodies?
Thanks, Amina. Before I respond to that, I just want to just pick up from where Swee Kheng left off. When you asked about the question about media, of course, you're suggesting traditional media, but it's actually been complicated by social media. And this has really affected messaging, and it really feeds into the issue of trust. So it's a question of whether populations at the national, regional, international level trust their governments in the first place to make the right decisions. And I think it varies across countries. And then, of course, whether people trust the media, the traditional media, because if not, the social media provides a lot of fodder for all sorts of unscientific and unsubstantiated information, which complicates. So even if what Swee Kheng suggested follows through, then you will find that it makes it actually quite difficult for well-meaning governments to convey solid scientific evidence-based messages to their populations. Now, picking up from that, when you ask about the role of regulators, the same issue applies. Do the populations trust their regulators in the first place? And here it's not just medicines regulators, because ministries of health are essentially regulators as well. And again, if at the societal level or culturally there is strong suspicion, it's going to be extremely difficult, no matter how well-meaning or well-informed a regulator is, to be able to have the voice and the influence necessary to influence things. Now, my last point that I made in my slides is something that I'm thinking through because it's evolving. Actually, prior to the launch of the pandemic, of course, people hardly knew all these terms that regulators talk about. In the regulatory community around the world, there are all these terms that people use. But now, of course, every other person in the lay public seems to be talking about issues that regulators themselves were talking about for a long time before that. And so it is incumbent upon regulators, which is why capacity building is important, to arm themselves with the knowledge in the first place, the technical scientific knowledge, and then secondly, the skills to communicate properly, both to policymakers as well as to the public at large. And this is honestly a big ask, even if you look around ASEAN, because some of our regulators are a lot better resourced than others. And so this is where it's important for a regulatory community to come together at an international level. And there is a body that was set up in 2014 the International Coalition of Medicines Regulatory Authorities, which is currently led by the European Medicines Association Agency and co-chaired by Australia and Japan. And they have facilitated the sharing of information. And by using these kind of forums, it's easier to engage with the WHO, to engage with national governments, to sort of explain what are the regulatory considerations when you're making these decisions on new products like COVID-19 vaccines. So trust is important. Capacity and the ability to communicate is a second important thing. And I think the third really is the need for international collaboration to address these kind of issues of messaging, understanding, and public acceptance.
Yeah, so that's, as you kind of ended your opening remarks with that quite optimistic view that yes, these things will be going in the right direction. So maybe I'll ask Susann now to, from a kind of regional perspective, how do you see the conversations evolving? What direction are people going? Are the scientists and the regulators able to tap into any kind of regional or international, the one that John just mentioned, the international forum, to make these conversations more robust and to make them not just a conversation, but actually to be outcome oriented, to have that clear link between the two?
Yeah, it's an excellent question. I mean, this morning I moderated a session on futures and foresight for the region. There was someone who came up with the expression toxic optimism. So while we want to be optimistic, I think we need to think about different scenarios here. What could happen. And I think one scenario is that government budgets will be depleted after this crisis. And then we have to be very cognizant of the fact that health sector might not see the budget it needs and is required to recover. So I think we all in this international community, development partners, but also academicians and countries themselves and the health sector stakeholders in the country and the citizens need to step up and voice this and say, we've learned from this pandemic that health matters. Health is important for the economy. So we need to invest in the health and well-being of our people. I think this means also that a lot more money needs to go into regulatory agencies. There have been business cases that have been developed, for example, in Mexico a couple of years back, that made the case why it makes sense to invest in regulatory agencies also from an economic perspective. But we need to see a lot more of these business cases. So we need this collaboration between the regulators, the ministries of health, and probably the finance people to make the case and mobilize this money and the funding. And I mean, if we look at the benefits, the silver lining of COVID, which is maybe faster research and development, faster access to market of new medical products and technology, we can only take advantage of it if we have a lot better regulatory capacities in countries, including a lot better post-market surveillance and research capacities. So I do hope that we will see this, but we need a lot more noise at the global arena, a lot more dialogue in these sub-regional groups, and we need support, financial support, to make this also happen.
Yeah, and I think I like the word noise. I think we do need more noise about this. We need noise about, what's happening in this field. And maybe the other point that you made in your opening remarks about the impact on the other aspects of health, the health ecosystem. What impact has this had? How are we going to be looking at our future health budgets? How are they going to be distributed? What are we going to be considering? So would you mind expanding on that a little bit?
What I mean with that is, I mean, if we look at what's happening now, and we need to bring everyone's awareness to this, we see a huge drop in vaccination coverage just with regular vaccines. I mean, can you imagine this? And these are the most vulnerable, young children who are not being vaccinated. We do see, financing of COVID vaccines for everyone, people who might not be even at high risk to develop severe vaccines. Again, I want to make sure everyone knows that only around 5 to 7% of people actually develop severe symptoms from COVID, but we still don't see governments, for example, financing vaccinations against cancer cervical cancers, right? A vaccine which has been around for many years. Most developing countries don't pay for it. So I think these are things we have to also highlight. We also have to highlight that many people in Southeast Asia, around 80% of cancer patients are diagnosed too late. There's nothing we can do anymore. This is, compare this with your chance to survive as a cancer patient in a developed country. These are the inequities that we need to now put attention to and raise policymakers, accountability, because if we can show during COVID, we showed we can take whatever it takes actions to save people's lives, and we have to do that for other diseases too, and for many other vulnerable people and vulnerable groups.
Yeah, excellent point. We should, use the positive, not toxic optimism, but use the lessons we learn in a positive way to make sure that they're applied, into other degrees, and we can, in fact, improve our health ecosystem. But I'm also been kind of looking at the questions coming from the audience. Some of them are a little bit specific to, specific vaccines and, what is the efficacy of them. So I'm not going to ask this panel to address those because, this is a policy panel and not a scientific panel who will tell you exactly what the efficacy of a specific vaccine, etc. is. But maybe, Swee, I can ask you to maybe comment on some of the new kinds of vaccines that are in the pipeline, the issue of, how are they clearing vaccines, what is it going to be looking like? So not asking about a specific vaccine, but just what's the landscape looking like?
Amina, unfortunately, I won't be able to give a good answer to this because I've not been paying attention to the new vaccines that are coming through. So I can't give a bit of a state of the art play-by-play of what's happened. However, if you permit me, Amina, maybe I'll answer the question in two different ways. The first one is to say that we all hope for a second generation vaccine. So all those vaccines are currently in the pipeline and are currently being approved or being reviewed and having clinical trials. I think they're all great, but we're all hoping for the gold standard, which is a pan-coronavirus vaccine, that it goes through all the 4 genuses, 4 families, and that it can go not only SARS-2, but also SARS-1 and the various other coronaviruses that's available. I don't know how far away we are from that kind of a vaccine, maybe 2, maybe 4 years away. And once we have that kind of a vaccine, maybe also it doesn't have to be injected. It can be given intranasally or even sublingually or intradermally, for example. It doesn't have to be intramuscular or subcutaneous. Not subcutaneous, I think no vaccines are subcutaneous. But anyway, there are different types of, say, modes of administration that we can consider as well for the 2nd generation or 3rd generation, hopefully a pan-coronavirus vaccine. And secondly, is to say that, and here I'll be interested to see what Prof. John Lim might be able to share as well. Is whether or not we can use, say, an accelerated way to approve vaccines. What I mean to say is maybe we don't need a randomized clinical trial for actual clinical outcomes. And we may be, for example, thinking about approving a vaccine from a regulatory perspective, just based on in vitro data. For example, the immunoreactivity or the immune response that's generated by a particular vaccine in healthy human volunteers without waiting for endpoints like infections or hospitalizations or deaths. And that could be it's a very different paradigm. I'm not saying I'm supportive of it, but I'm saying that some people are talking about this, and I think it's worth a good debate whether or not we want to shift the goalpost a little bit in terms of moving away from an RCT with measuring clinical endpoints towards only measuring immunological endpoints. Maybe I'll share these 2 thoughts, Amina, and then over again to you.
That's an interesting option to consider. I'm sure all the options are being considered, but maybe to John, then, further comment on what Kheng said, and also maybe specifically comment on, there's so much talk about the Delta variant nowadays, and I'm sure there'll be the next variant down the road. Is there something that would change in the way vaccines are regulated and, approved, thinking of these variants?
So again, picking up where Kheng left off on this kind of pan-coronavirus vaccine, it's actually not just a pan-coronavirus vaccine. I'm actually involved in another initiative that's looking at a pan-influenza vaccine, because it may well be that the next pandemic after this one is over comes as an influenza virus. So I think we have to cast the net wider. And while we're right in the midst of this COVID-19 pandemic, there are other types and families of viruses out there. And so the scientists are looking at this kind of holy grail of having a vaccine which really is able to just cover a spectrum of viruses. And also, I think, to then deal in the specific context of COVID-19 with the variants, because that obviously is something that would be very much otherwise you have to keep looking not just at boosters, but then tweaking the viruses. Now, there is a lot of research going on. Again, like speaking, I don't know the specifics of it, but I am aware that people are looking into this. And when it comes now to the role of regulators in terms of supporting that, the first thing that needs to change is that developers and regulators need to talk early. In a sense, there's no point them functioning in separate silos, and then down the road, they try and merge the data, because if you don't plan even traditional trials properly, by the time the data comes to the doorstep of regulators, and if it's off target, that's not very helpful in terms of the development process. So one of the key things that most regulators around the world now are talking about is early discussion. Having said that, it must be carefully managed, because you cannot also, regulators cannot be seen to be in the pocket of industry. That is actually very fatal if that happens. So there must be a proper platform for these discussions. And then really when R&D is going on, that trials are designed in such a way that it produces the kind of data which regulators are looking for. Now, flipping it around to what Swee Kheng was saying, regulators do need to change, because if you just stick to the traditional clinical trial paradigm, clearly we're not even seeing that now in the context of the COVID-19 vaccines. People are looking at real world data and real world evidence. And so, as we were saying earlier, you're looking at booster doses, not in the context of all the data packages ready for the regulators to make their final decisions, because the preliminary vaccines in their own right, many have not received full marketing authorization. But looking at real world evidence and data, like, for example, countries like Israel that have vaccinated their population to a high degree and are tracking the outcomes of that and the sort of demographic implications, these are the kind of things where regulators need to change their assessments and what are their decision points. What are appropriate correlates of protection for vaccines? What are appropriate endpoints which they can make a decision on, where they can still meet the requirements of safety, quality, efficacy? So those three words are important, because they're the kind of mantra for any medicines regulator. You need to ensure safety, quality, and efficacy of the vaccines or any other health product. But what you use to make that determination is clearly changing. And the use of big data is a major way of addressing it going forward. So that, I think, it's already happening, and I think it needs to happen faster. And the regulators really need to talk together with the developers, the scientists, to then come together on endpoints which can make that decision faster. And so and of course, I hope I'm not practicing toxic optimism here, but I think we must face the fact that the world has changed in the course of the last 1.5 years. And in fact, picking up a point that Susann made, if in fact policymakers, regulators, whether it's the finance ministers, whoever, are able to come together in an appropriate way, then in fact there will be positive outcomes from all this tragedy that we're facing now in terms of the global pandemic. And there is a window of opportunity. So I'm optimistic if that window of opportunity is well used. Otherwise, the window will close, and then we will be, in a sense, well, whether it's post-pandemic or endemic COVID, we will still be struggling through this by the time the next pandemic hits. And that's clearly what we do not want to see.
Call to action at the time of when it's appropriate. But you mentioned the one group that we haven't talked about so much, and you mentioned them, and maybe I'll ask Susann then to elaborate, is the private sector. So, you know, there's a lot of talk about the whole IP issue on vaccines and other medical products for COVID-19 specifically, and again, enlarging it to, you know, a larger issue even beyond COVID-19. But for now, looking at IP for COVID-19 or other kind of drugs that are being developed, as you guys are familiar, there's a lot of kind of international controversy on this, with the private sector more or less on one side and some of WHO and the other kind of major NGOs on the side that you should be having opening it up and having free access to it, but relating it also to the manufacturing capabilities that kind of go side by side, because I'm trying to relate it to a question from the audience who asked about manufacturing. So where are we on that? Where are we on IP and on manufacturing capabilities? How do we expand that to look to a future where we will have greater capacities?
Yeah, I think if I pick up there, very interesting discussions happening there. One silver lining, back to John's remark on optimism, is that what we have shown the world is if there is money, there is possibility. So if governments, national governments, are committed to finance treatment or diagnosis of certain diseases, this creates a signal for the private sector to also invest their research and development efforts in these areas. And I think that's what we've seen in the past, a very uneven focus of research and development on treatments and diagnostics for richer countries because they are able to afford it. So there was a lot of focus on cancer and non-communicable diseases, not so much on infectious diseases. And I think there is a shift maybe happening. So if governments can commit to financing vaccines of new generations, we can see now there's more research now in malaria vaccines, tuberculosis, HIV/AIDS, also certain cancer vaccines. This would be great. This would be a great signal. But for that, we need policy. We need that dialogue that John and SK spoke about, from regulators, private sector, and governments, and making commitments to their populations, what kind of public health programs they will fund, not just one election period, but beyond that, right? Because the research and development cycle takes a lot longer. So I think that's an important message. What we see in the private sector is, yes, they are looking into new markets. They are also looking to diversify their research and development hubs. Singapore obviously is one very important one in Southeast Asia, and then making links to fill and finish plants in Asia and several countries, because they're driven by national interests, are trying to set up these fill and finish plants. I think what we see is more of a hub and spoke model, where research and development will continue to happen in more advanced and developed economies, because you need this entire ecosystem of logistics, supply chain, research and development, and maybe the fill and finish will become more available to more countries. But saying this, at the same time, seeing now the opportunities of biosimilars, there is obviously a great opportunity for developing countries to invest in new industry verticals in pharmaceuticals. And hopefully we'll also see that, which will obviously increase access, affordability, and so on. So I think, one important statement to make is investing in a regulatory agency in the developed countries will also help to develop a pharmaceutical industrial sector. Okay, I think Amina has a technical challenge right now.
Yes. Can you hear me?
Yes, we can hear you.
Okay, sorry about that. Sorry. I might have missed the last second of what you spoke, but
I said something about the pharmaceutical industry development, and I don't know, SK, maybe you want to say something. What are you seeing in Malaysia or some other Southeast Asian countries? Some momentum is there, right?
There is, Susan. I think. Let me speak a little bit for Malaysia, then extrapolate overseas. I think many countries, I can't say many countries are thinking that they need to develop their own vaccine industry for two reasons. Number one, so that they're less reliant on the international supply chain. And even a country like Malaysia, only 32 million, we find it very difficult to negotiate, to procure supplies. So there is a bit of a case for pool procurement for 650 million Southeast Asians. So Pfizer, GSK, AstraZeneca finds it very difficult to ignore 650 million people sitting at the same negotiating table with them. That's one big reason why countries are thinking about building their own vaccine, say, independence, so that they don't have to rely on say, foreign supplies. But the second reason is countries like Malaysia are trying to position ourselves to export. For example, Cyan Biosciences in Thailand is aiming to export to Southeast Asia, and so is PT Biopharma in Indonesia as well. This kind of regional expansion strategies, I think, are meaningful. Hopefully there'll be some regulatory framework in regulatory convergent or harmonized regulations in Southeast Asia that provides an opportunity for private companies to compete so that we can drive costs down and increase quality. Susan, all this is to agree with you that there is a lot of momentum. Over again to you.
Thank you. I think back to you, Amina.
Well, I'm actually looking at the time. So I think, unfortunately, we have to wrap up this very interesting discussion. And maybe I'll just ask each of you to give, a 1 minute, closing remarks. So maybe, John, we'll start with you.
Well, I was thinking one thing we have not discussed at all in this is the impact of climate change. So of course, that's a whole new topic, but I would like to just leave that as maybe something else we need to talk about, because this is going to affect not only the nature of diseases and affect our various countries, not just in Southeast Asia, but around the world, but it will have an impact, therefore, on health systems. And although it goes way beyond what we're talking about today in terms of COVID-19 vaccines, these kind of broader issues need to come into play. And then, of course, I think the other second issue is really everything we're talking about seems to be still predicated on the existing trade system that we have. And we have to be very conscious of the fact that the geopolitics is changing. We're in a somewhat different world. And I think this cannot just be within the realm of regulators and health ministries. At the kind of far larger global level, I think policymakers need to begin thinking about this to address the issues, not only what we're facing now, but really to harness the lessons learned so that we can begin to address future challenges. Because we keep saying this is not going to be the last pandemic. There are probably going to be other things. And then, as Susann said, other health issues have not been addressed. They're being terribly neglected simply because of this very strong focus on COVID-19, and understandably so. And so I think there needs to be a very broad-based view of the future, really picking up points that Susann had made, which I think policymakers, stakeholders need to come together and realize that just talking about COVID-19 vaccines in isolation from the broader global issues going around us may solve immediate issues, but if not harnessed properly, will still leave us very much exposed for future healthcare challenges down the road. So I just put that on the table. Maybe, Amina, you need to organize another webinar after this, but I'd like to leave it at that. Yeah.
We actually, one of the second webinars we ever did was we involved some climate change people, and we did talk about it. It was early days and people were, I think, still very distracted on where's this virus going, but that conversation needs to be brought back all the time. And yes, basically keep that broad systems view, always in mind. But SK, you want to say a few closing remarks?
Thank you, Amina. It's been a pleasure to be here, and maybe to follow what Prof. John Lim has set out to do as well. What I would like to say is the things that we didn't talk about. I guess what we haven't really talked about is the impact of variants, firstly, and what variants will do to our vaccination program. Secondly, what this webinar in the last 1 hour or so, what we haven't also talked about is our over-dependence on vaccination programs. And politicians, political leaders, even just the average citizen, were putting a lot of hope, faith, ambitions into the vaccination program, to the sometimes almost total exclusion of everything else. But we cannot do that because this pandemic really needs multiple pieces of the jigsaw puzzle, not just vaccination. So we haven't really spoken about our over-reliance, either systemic or political or psychological, on vaccination programs. Thirdly, and finally, perhaps we haven't really spoken about what do we do for round 2 vaccinations. Those are interesting topics for future ones. Amina, over again to you.
Yes, thank you. We will consider all of those. And Susann, over to you.
Yeah, thank you very much. I would like to close with a call for action for the audience here, everyone in this webinar, that we all have the responsibility to make moral decisions, and not just decisions for now and in the interest of certain people's agenda. So please, in all your positions and jobs, take a moral approach, think about what's best for the majority of the population, especially for also future generations. And we need to always consider that there is a cost-benefit consideration in the kind of decisions we make for regulation, but also for research and development, and of course for the kind of health programs we fund. And I think to end on an optimistic and positive note, what we do see is a revival of public health.
Thanks. Those are great thoughts to think of. And absolutely, I endorse the view of, looking at it from a moral point of view. I think also for me, it's been like the role of communities and how, we talk about the regulators and we talk about policymakers, but really we are individually responsible and we are collectively responsible. So how do we kind of engage at both those levels? But with that, because we are over time now already, I will just say thank you to all three of you. It was absolutely wonderful to have this conversation. I hope the audience kind of gained, useful insights from it. We will continue this discussion, and thank you to the audience for being with us. And please look out for our next ones. So thank you to the SDGHI team for organizing it, and we'll see you all again.